Boa tarde e bem-vindos a todos os participantes em nome do Fundo Educacional do IAS e QAM para esta segunda sessão do simpósio. Eu sou Mônica Negrete e irei moderar esta sessão, que vai se concentrar no engajamento de adolescentes e jovens como atores principais na resposta ao HIV. E num país onde a média de idade da população é de 16,6, segundo o censo moçambicano de 2017, e 53% da população tem entre 0 e 17 anos, o engajamento da população jovem e adolescente é fundamental, também para abordar a prevenção, o tratamento e a retenção aos cuidados de HIV. Além disso, em Moçambique, segundo o IMACIDA de 2015, resultaram positivos para HIV 4,3% entre 15 e 29 anos e 10% entre 20 e 24 anos. Por esse motivo, é essencial um forte compromisso para garantir que os jovens e os adolescentes sejam os atores principais na resposta ao HIV. Temos uma programação muito interessante hoje de palestrantes para estas sessões que comentarão sobre o tema e participarão da sessão de perguntas e respostas, durante as quais vocês, os participantes, vão ter a oportunidade de fazer essas perguntas aos panelistas. Esperamos sinceramente que a programação seja valiosa para todos no seu trabalho atual. Para algumas regras de convivência, vou dizer que a interpretação em inglês e português está disponível para aqueles que estão conectados online. Pode, por favor, selecionar seu idioma para ouvir as apresentações e discussões na língua da sua preferência. E convidar também a todos os que estão conectados virtualmente a se apresentarem através do chat, que podem encontrar logo abaixo da tela. Verão que a sua mensagem aparece na caixa interativa à direita da tela. Pode digitar o nome, o apelido, a organização para a qual trabalha e o país de onde vem. Vamos usar também esta oportunidade para nos conectarmos e nos conhecermos, né? Se você está tendo problemas técnicos e não consegue ver a caixa do chat, eu estou a sugerir para mudar o navegador da internet e dizer também que podem usar a mesma caixa do chat para as perguntas e respostas logo após as apresentações, e são bem-vindos, mesmo muito bem-vindos, também comentários aí no chat. Gostaríamos também de agradecer, ao nome do simpósio, ao Vive Healthcare, Mer Sharpandom e Gilead Sciences, pelo apoio a esse encontro virtual e por torná-lo possível. Como um participante ativo do simpósio do Fundo Educacional IAS para Moçambique, cada um de vocês tem a oportunidade de receber um ano de membresia do IAS sem nenhum custo adicional. A associação será ativada assim que você preencher a pesquisa pós-simpósio e marcar a caixinha na pesquisa solicitando essa membresia. Se você já é um membro do IAS, essa membresia será então estendida por um ano. Obrigada. Vamos lançar agora, então, algumas perguntas introdutórias para a vossa participação e nos dizer como que estamos a sentir hoje. Ok, eu sei como eu estou a me sentir e talvez essa mesma motivação e interesse, vamos ver o resultado do poll também. Muito obrigada pela participação, vamos nos apresentando no chat. Não sei se já temos os resultados. Excelente. Então, a maioria das respostas é precisamente que estamos todos a nos sentir muito bem, motivados e com grande expectativa. Muito obrigada. Agora tenho o prazer de apresentar a doutora Leni Couto. Ela é a nossa primeira palestrante para esta sessão. A doutora Leni é a chefe do Programa de Controle de AIDS, HIV-Sida no Ministério de Saúde aqui em Moçambique. A doutora Leni irá apresentar o resumo da reunião do Fundo Educacional do IAS para a África Austral, baseando-se nas principais recomendações. Doutora Leni, muito obrigada. A palavra é sua.
Thank you very much. This moment to do my presentation. Can I have a full screen? This presentation, as I said, I'm doing showing the recommendations. So it's drawing from the key recommendations from the last workshop that we had in March in terms for the Southern Africa. In terms of introductions, we can say that the Southern African region carries one of the highest HIV burdens despite of notable progress. We can see this from the map on the right side, that the darkest red is the where it represents the Southern African region, and we can see it clearly that the new infections still high. Therefore, many of the countries in the region are not on track to meet 2030 UNAIDS targets. So because we still the burdened countries in terms of HIV. In terms of a background, what I can say that from this workshop is that the International AIDS Society and the Desmond Tutu Health Foundation organized in 25th and 26th of March 2021 a workshop with this theme, the last mile, the longest mile, realizing the promise of an AIDS-free world. So we want to really still go into AIDS-free world. This workshop assessed the key regional priorities that was required to make progress towards reducing new infections and improvement of treatment outcomes. Since that we are the burdens countries, we have to really make sure showing where are we and where we want to go in terms of reducing new infections and what's our outcomes in terms of best viral load suppression. And this, to reach this reduction of new infections and treatment outcomes, we focus in 3 priority areas, which was scale up of PrEP for HIV prevention, since this is the new ADAP for the combined prevention, the children health and progress towards ending PMTCT. PMTCT is still worried for countries like Mozambique, and also the mental health in the context of HIV. Based on those 3 priorities that I showed here, what was our conclusions? We had so many conclusions, but we had some key conclusions. First of all, we have to make advocacy for prevention. To make this advocacy for prevention, we must have a good leadership in our region. We have to have supportive policy environment in our region, saying that it's important that the leadership in terms of HIV still have to make advocacy, and also we have to make improvements in terms of policies that they are supportive in order to reach what is needed to have a good prevention in the region. In terms of integration of service, what we said in terms of integration of service, that HIV prevention was is something that we must still put as a priority in the agenda. So when it comes to talk about HIV prevention, it's not just talking HIV prevention as a verticalized, but as something that is holistic in terms of all layers, in terms of all levels. So we have to really integrate what is HIV in prevention. Also, we have to integrate HIV prevention in family planning, sexual reproductive health. Also, we have to discuss what is important to be discussed in terms of HIV on those programs, and also we discuss about mental health and psychosocial support as something that is needed to be discussed in more granularly and more deeply. And in terms of conclusion, also we discussed about stigma. How can we removing barriers to not reach what is needed, but knowing that the stigma is still one of the biggest barriers that is really still moving on, the driven, not reaching what is needed in terms of targets. So when it comes to stigma, we discuss in terms of external and internal stigma, and how can we reduce, or how can this internal and external stigma is really reducing, what can I say, is interfering in terms of reducing HIV outcomes and well-being of people living with HIV, access to care, and poor mental health. In terms of quality of care, we have to strengthen the healthcare system, including person-centered service, consistent supply, and increased support for health workers. In terms of engagement, new message has to come. When it comes to message, we have to revitalize of message of better engaged clients, This message has to be gain-framed, future-oriented, promote, educate new prevention treatment using peer educators, ambassadors, social media influencers, health, including religious and traditional gatekeepers. Messages should be age-appropriated, targeted, and tailored. So when it comes to action items, we have to do integration service. We have to do package of integrated service. Mental health has to be added up. We have to deliver service at communities. We have to revitalize engagement, increase uptake, implementation tools, but also we have to prepare the future by intervention, prevention, health service. We have to get granular by analyzing the data, identifying stumbling blocks at all levels, and health system has to be strengthened. So in terms of patients, we have to empower community, we have to empower patients based on community-based in terms of health planning, prevention measures, integration of psychosocial support, and normalizing access and uptake the broad range of service. So to do this, we have to be on this together with the government, also as well as. Mônica, eu terminei a minha apresentação.
Ok, obrigada, doutora Leni. Muitíssimo obrigada pela apresentação.
Thank you very much, Dr. Leni. It's an interesting presentation. It's important. I thank you, your leadership, your advocacy, and everything that touched on. Next, I've got to present Dr. Masalaman, is the director of MISA in Beira province. He will present about the experience of SANS for this service.
Dr. Massalambane, muito obrigada, a palavra
Dr. Salambane, obrigado, e a palavra é sua.
Eu me chamo de Fino, mas sou
Good afternoon. I'm a director of the health center in Sofala province. We'll talk about the activities. First of all, I have to tell you that it's important for this province, Sofala province, and I would like to hear from a contribution what happened in Beira. And instead of Beira, we've got other districts that are affected. Now they've been doing all this action plan. So we need support in this health center. And this activity of promoting the health. And when it comes to HIV, we've been working with different areas, but we're going to talk about the health services in our province. Now, the people that we cannot give that message, it will be difficult to start. And then what we have to do is have been working in the place so they can help the youth on these health centers so that they can also be part of this program. So we can help them to do these activities because at this process, we have so many activities. At this point, we done this study, but in 1996, we've seen the youth in all the province. Not only that we've been doing all these activities in relation to tests, we test on the street beside the health centers, because what we need is what is the prevalence of the disease. So in this, we have to do, we've been working with RBD. So if they start taking all, or if they can start their treatment, and if they start this treatment, naturally, it will be our, to keep this, we keep this use to care of this treatment. Not only him, but we need to also to give a retroviral, and so that he can miss, but he must continue to take this treatment. and in all our districts in the Sofala province, being is that we work together. In our province, we have a process which is strong in terms of the number, uh, the prevalence, those who we at least want 90%. So our work is fundamental so that we can be able to go and work against this HIV. Not only this, when we have other services, when we have to rehabilitate with a specific person, as well as we also check other groups that the rehabilitation, which is very important. And we also been working with different group of youth so that it can be able to formulate. And we also have been working the capacity in relation of control, what are activities, what are alternative measures to be used. And we also been exercise in terms of this capacity. Youth that they can do this activity. And we can also do this research work. So we got a lot of activities that we are in place. Not only we got another activities that we've been having with other stakeholders. At this time, because of this COVID-19 pandemic, most of the youth, they're not coming to the site, but we get the information, we share the message for the communities. Not only we do that, we also recover, we also deliver within our number. Is where we see the pandemic and this term. One cannot come, but whoever is affected, was infected, he can only come, and then what we have to do is
para podermos fazer com que ele continue a
we
fazer
have to make sure that we will continue to take care of his treatment so that he can improve his health system. So many activities which are we talking in terms of this province. Thank you very much for having us. We need your support. We have to continue to fight. We have to finance what we have prepared at the moment. And also, we thank everybody that have been working with this improvement, getting a solution, and so that we can have a health, because those who can influence, so our patients can feel the presence in the health center with needs, the needs that a patient has, which are in relation to all this, you must overcome, and we have to improve in terms of what we, a prevention of these services and a medication, and to those who have been affected by this pandemic and other diseases that this COVID-19 is a big challenge for us. So we're here to continue to provide good service. Unfortunately, Sofala province is the fourth province in terms of prevalence of HIV. So it means that besides this difficult, we are fourth in cases. So with our prevalence and in relation to this country, we as a province, we are ready. We can imagine what is the impact of this disease. We need more conditions and direct assistance so that we can be able to provide good services. We can also go ahead. What are the services the basic service of health for who need those services. Once again, thank you very much. Thank you very much, Dr. Rufino. Thank you very much for. Now I've got the pleasure to present you three panelists that will do presentation of the key self about the youth and HIV in Mozambique. Ana Menier, Fernando Janqui, they are a technical team. They work for ICAP and they will do the perspective of the youth of Mozambique. Their presentation will also come directly for Dr. Furnis, who will talk about same theme for the reference of advanced disease. Dr. Nes has got a master degree in science and a PhD. He's in Mozambique since 1983. First as a clinic, as a professional health worker in the rural and provincial area, and also specialist in health, public health, uh, health publicly, and his professional career, doctor, he worked with multilateral World Bank, WHO, Minister of Health, especially in Mozambique. Ana Fernando, the platform is yours. Thank you.
Olá, chamo-me Joaquim Fernando.
My name is Joaquim Fernando, known by Fernando. I'm a young, I live with HIV since 2006. So I'm 23 years. I'll talk about my life, in this case, the experience, professional experience about HIV, and also my own experience as a youth. Starting to talk about the experiences. This experience started on helping groups when I was still young. I was a boy, so that started in Central Hospital Central in Maputo. I was there playing with friends. I ate what I could manage to, and with time, as I was an adolescent, it is the segment of process of revelation. Is when I get to reveal my status. But I knew that my situation, but I grew up in a college where we had a lot of children, and all those children, they took some medicine, what I took. So the medicine was the same, but the only difference, I was only more responsible because I used to go to the hospital alone without any company. So I was curious to know, why do we have to take medicine? But I'm the only one who goes to the hospital alone, and then no one comes with me. Is when I put a name, I put an internet, and I consider HIV. At the beginning, I didn't take it seriously because I thought it was lies. But after some time, I knew that, and I was sure, yes, I'm HIV positive. So I was part of a support group. So in 2015, I had an opportunity to be part of Forum of Young, which Foundation had organized, is where I met a lot of youth, but I was also used, but what I knew, it was only about the central hospital. So that we also have a Cabo Delgado province when I had this inspiration to see other youth that live with HIV, to share their experience and with my experience. So that came together, and then something grew up in me and needed to be part. I wanted to be part and support other young ones or youth so that they could not make the mistakes I've gone through, because they must just do what a therapeutic path. I had stopped for 2 years this treatment because I went to secondary school that was in standard 9, where a lady, she came to me, she said, she's got a treatment that you can do where you can get better. I said, it's fine. I went through with that lady with this treatment, but I knew there was a need for us so that I can tell her that I'm HIV positive. So when I spoke about my state, this lady said, this medicine is not, it's, oh, you do a treatment for the skin or you carry on with other. But that time, my need, it was because of my skin. I left everything and I started to carry on with my skin treatment. So slowly is when CD, for which it was exceptional, it went down drastically. So I hid that for all my sisters. But when I saw that the situation was really, really bad as well, with that, I took that as a, in that forum, I took that as a something that could, that cannot happen with other young ones. So that was gave me more confidence to be part, and I wanted to be part to share my experience, and so that could be able to help not only me. So when the RL Foundation gave us a support to, it's called an association, and we worked with different young ones so that we can motivate them so that they could not go through the same mistake that I've done, so that they could go back and get a treatment. So that was a good experience because that empowered me, and that it was an example. And for me, I've done that treatment because so that can be an example, so that can be like an example. So in 2019, I was in Nampula. I had an opportunity to be there. I didn't know. I just went there as a consultant. So I had that experience of consulting in 2019, 2021, which is this year. I'm here. I, I'm doing, I started with doing that by ECAP. It's a combined study, which is to work what is the vision of the youth in order to have this situation. It's a big research. It's a first time that I'm doing the same type of research. So I'm looking forward to be part of that research team and support the other young one to continue to adhere or the treatment so that they can have this same situation that I've got. Because I'm someone that has got an excellent situation. So I have to see other youth. Through that research, they can also have this situation, which is the objective of this. That's all I had to say. My name is Anna. I'm 35 years old. I'm also HIV positive. I found out that I'm HIV positive when I was 14 years. That was in 1999. When I discovered that I was HIV positive, I didn't share with my family. Initially, I just kept quiet. I made it in the secret, but I could go to the consultation treatment, but I wanted to know more. I had curious to have to know more about this disease. What was I supposed to do so that I could not be affected? So besides this, besides the counseling and debates, and in this debate, I received a invitation to be part of the supporting team, youth that lived in the same situation, a support group, which was HIV positive. So that was interesting for me. I was part of the group, that support group. and then I received more information that I didn't know, and I didn't have a lot of experience. There was a lot I wanted to know, but I was not uh, bold enough to confront my parents or the health workers, because what was could be, I didn't know what they could react. So that support group helped me a lot, so that I could understand a lot of things, so that I could overcome some barrier, which I knew that there were barriers, but truly there were no barriers. So from there I had that willingness to learn, and I could also teach other young ones. So it's when I started to participate in the, I could go to school, and from there I went to such. So I've learned a lot, and the health workers, they show they saw some interest, so they shared some information, which we from Pathfind is where I started to take some courses. I've done some courses, uh, visits, and debates, and from there I started to develop these kind of activities we could simulate, and I started to be on the site. I went to visit in the waiting room, so that I could convey what were all my knowledge for other youth living in same situation. And we also created support groups. So it's when I started, there were new opportunities that came up, because I worked for Pathfind as an activist, and after that I worked as for CCF, but as a counselor of ATCC, is the counseling in the community. So I've done that work. I could do the counseling not only in my community, but I would go to health centers, and I also worked in same area at the CC, but more on a key population and other drug users. With that, I've seen some change. I've seen some change here, because from 2007, as I started to do those activities, uh, until 99, 2012, 2015, I've seen a lot of change in terms of dedication and interest on part of the adolescents that were working in the same area, because a lot of young, they didn't have that boldness, even or the waiting room where are in same situation. A lot of them, they're still hiding themselves. They hide their situation, their status. So they just go as a normal patient. For us that we live with HIV, I hope that we'll have more projects that could be able to do and target those young which are in the situation which they don't know where to go for help, seek for help. So my expectations are that in this case, I would be able to target those young, and we can see them in the health center, so that they can be able to be in an transmissive way. So it's in this way that I can finish my presentation.
Ok, então, boa tarde a todos. Meu nome é Ferruccio Vio. Eu vou falar
Good
rapidamente.
afternoon, everybody. I'll talk about the perspective of CREM, which is for youth that live in HIV, and those who can think what are the implications to overcome. What is CRAM? It's a reference point with patients with advanced illness. So in this clinic, so most of the health are transferred to and with a health disease and also pathologies which are associated to HIV. So the psychology work for these patients, and we also will give financial support to be able to have an intervention for the hospital transport from home to the health center. So we also work to have a line that will be in all the clinics that they work in the area, which is strong, and so they can be able to follow the patient, and they can be able to include the patients which are in a complicated situation and they need some assistance. Grama is a healthy center for all the protocols and all the working instruments that are the people who are in advanced disease. And finally, it will also be a place for healthy workers. So in this, the next slide, please. We can quickly see this is a graphic on the right hand side. You can see this graphic that can give you an idea of the prevalence of or the incidence of group H. You can see which is high between the young ladies in relation to 3 times in relation to the boys. So you can see we have to update this prevalence with an incidence in new infections from the 15 to 23 years. You can see these young ladies, they've got a high number of prevalence, which are 3 times more than the boys, and it's superior. So we can consider this age from 15 to 17, which goes up to 24 years. So we got a lot of problem with prevention, with the primary prevention. Now we cannot avoid that in the important part of these young boys, our youth, that can be affected by HIV. So here at the bottom, we can also see what were before the children in general. This shows a figure of 2015. We can still see that all the indicators that will be part of 1990, which are the key for the diagnosis for appropriate treatment. It's more for children and adolescents, which is lower than the other group. So this is the situation that we have in general. So this new slide, which the activity that we present to the youth, we got in the first place a summary of the health ministry, what are the pathology, who are the patients which are referred to with trauma, and the first two, you can see, like for a TB, it can be lower than 50% in the therapeutic system, what means that this a high number in relation to others. In this age group, you can have a technology, you can say a therapeutic, which are the causes, which are important cases. You also have, in some cases, the pathology, which, for instance, which is sarcoma de Kass. So we can also have in this issue, as we see in the previous slide, the boys are less affected in relation to the young girls. So the access to this kind of treatment after the fact that they can be on an advanced age, advanced health situation. This slide, I'm not going to talk. I will leave it. I will leave for those who are in this issue so they can read it. This is a slide that will show you how the complexity of the clinical issues that we have, and secondly, the complexity of psychology problem. So I'll give you a minute so that you can read of this slide. This is the second patient. I'll show you this slide just to give an idea of the complexity of the resources which are needed to treat single cases with this gravity. These are the two examples, and these are frequent situations on the side. So in CRAM, so CRAM is interested to see is a special health center. Yes, it's a primary health center for healthcare, but we only have beds for the patient during the day. At the same time, it's a center of advanced health. So it's this health system is in a public sector, but at the same time, it will do in cooperation with international cooperation in relation to the resources, that the equipment, and all the expenses. We're going to say it's a reference percent, but it's a known place in an autonomy situation for the health, but we are a free health center, isolated, with work with an infrastructure which is limited and is not sufficient. So if we have to verify this work, visit the patient, we treat them, we can also think that it's inefficient, but truly any patient is going to take time and for human resource, for specialized people to treatment, and frequently in case of sarcoma. At the same time, I can guarantee that where our work is efficient center. Besides this, we have a lack of internet clinic personnel that they work with inefficiency, with a diagnostic and all the laboratory tests for individual treatment, so that we can have a therapy in the society. So this is the conclusion. I would like to bring to attention. We think CREM is a bring to attention for a civil society, because if you come to visit, you'll see a type of pathology that we have. You understand what CREM has been considered as a clinic. I can say we're not going to talk about emergency of see. We got about 2 million patients, 100,000 of youth which are HIV positive in the country. So it's a trend. It's a trend which is not special. So these patients, they've got a problem which not only is not psychological, is social and economic. The youth, as we've seen in other slides, in total is a big percentage, which is high due to incidence of high leakage of HIV, and also, unfortunately, we fight with a lack of social support and in family that cannot support in the way, and people that are on a building fence that they need still some support. So we can say it's local. So this institution or this type of care center, and secondly, in relation to the service sector, we can talk about prevention in relation to the general model of the society. In relation to this first point, it's need to bring to attention to the again, access and continuity of our clinical health for a social grant was found for mm, Doctors Without Borders from Switzerland, and they've been doing a very important and useful work. I also pay attention. We can also launch another program, but we know that every year we need to negotiate financial support. So GRAM is now in a financial situation. We can bring sustainability in relation to its strategy. It's very important to talk to you about this so that the youth one that are live with HIV, it's very important to avoid the secret. We have to be and distribute more condoms, and also the young ladies are more affected because they're not protected, because by a man older than them. So we have to share the knowledge, and this is a part of investment. It can be in school and in health, and this is the point in relation to model of society. So unfortunately, this is something that we have to live with in the last 20 years. So at least we've seen the value of our liberal society, which are a bit selfish and which is radical. And what we need, it's going to be important to touch of the public investment in a key point for a Mozambican society for health and education. At the same time, and we have to appeal for the change on the value, and we can have to be on a social solidarity, what we need to overcome the situation. Muito obrigado. Thank you very much, everybody. And my intervention will stop here. And thank you very much, everybody. Thank you, Anna. Thank you, Fernando, for this sharing and for this professional center. Dr. Ferruch, thank you very much for this necessary, what you talk about this need. Now we're going to watch two presentations with young with HIV, and followed by the panel with the theme. We have to present our first panelist, Moses Matope. Moses, he was a co-founder of Nigeria in 2006, and 2016 is a head of Association Region. Moses, the platform is yours.
Saudações a todos os participantes.
I greet all the participants of this symposium. My name is Moses Domingue. I'm a coordinator of a Nigeria Association. I will talk about HIV in the context of our activities. At this moment, I will do this presentation. In this presentation, I will touch a context. I'll talk about Nigeria, partnership, implementation area, activities, and at the end, I'll bring some indicators within our activities, success and challenges. Briefly, I'll tell the GIG Association. It means street children in Etna Sena, which is from Beira. So this association is for youth to develop development in the community. Nigeria is an organization with a non-profitable organization, and which was founded in November 26, and about 6 group of young, and it's got about 354 members, and most of them identify them as youth. This association got an objective to develop all the communities in area where a Mozambican child, so they can improve the level of knowledge in the communities. And this level of knowledge in the context of education, health, and sanitation. In terms of partnership, Nigeria worked with a lot of ONGs, with international partners. Besides the provincial government, we've been involved in different programs which are linked to health and special attention, which young ones within the Sofala province, where we can say Beira, Dondo, Nyamatanda, Buzi, and Merna. We've got a big experience to work in our community workers in a summarized way, where we have some merit awards, and we got a lot of certificates where we've backed. Continuing with this presentation, I'll tell you in terms of activities, information that in Nigeria, he benefited with a QUAM as a partnership. A QUAM, which is African for medical personnel, it was in the Sofala province, has been supporting some activities in benefit of the community. And Nigeria benefited from different activities. We have to sensitize our youth and adolescent, and within that community, we realize and youth activities which are very active and to guarantee same retention. So we have to also work about sensitizing, and we've done some psychological support in the community of Beira Dondo with a victim of the cyclone. So we have to also do tracing and surveillance of community, of the health communities. So we also have to do this activity. We have done some capacity. What we've mentioned here, we have done some partnership and some past in health support of psychological nutrition of HIV, the capacitation of all youth, and beside this, Nigeria has been in big activity with some patients. These activities are followed by some activists or within the community when we are supporting them. In terms of areas of implementation, actually, in Nigeria, we cover 7 health centers, 5 administrative points, and 26 communities in our city Beira, especially. I can mention some centers and some hospitals. We have as the first one, Health Center of Pontageia, Macurungu, Nhancojo, Mascarenhas, Inhamisa, Munhova, and we have Central Hospital of Beira. So in our administrative posts, we got about 5, which are within Beira City, which are Chifebe, Munhava, Mangalo Forte, and Yangao. And we also have a map on the right-hand side, which represents where our health center, where are all those 5 administrative points. So in terms of activities, to guarantee more, what are the objectives? we've done some debates within the community where we do some counseling in the community, where we got tents, sensitize collective and individual in a community within for health, sexual reproductive, HIV, nutrition, and other themes. We have seen visits patients on risk and those who are adhering to treatment. We also consult with the patient, and we also we've done support of this young for try this COVID-19. So in this organization, we do our activities representation with some indicators, and other side of the slide, we have one indicator which the CC. And this indicator brings some information from January to June, where within the activities that Nigeria said, we got about 1,147,000, which are youth, so that I can add there at the CC. Within this young one, about 772 were tested, and then 23 they were positive.
Adhering to the treatment, and the rest of the youth have benefited. They benefited from the counseling and also the need to use the contraceptives. On what they did has counseling. We found an indicator. Also, there is work being done in the communities seeking to have. So this graphic speaks about those who have been interviewed. In terms of stats, the organization benefits from these numbers by the work of the officials in health and also the IAS. So the organization does the follow-up on this youth. And they were identified. Only 200.
Esses são alguns indicadores em função das atividades que foram realizadas pela.
What are the indicators of what was done by the organization? In terms of success, it's important to refer that
Como sucesso que tem apoiado
during these activities,
amigos e adolescentes.
we have been supporting them in these services. In the health facilities, in these clinics, and also we carry out
Implementação das
the
atividades.
work,
Essas atividades são
implementation of these activities in the communities. These communities, we do it in the mobile platforms, in tents, and the organization also benefited from the doctors and partners.
São grandes sucessos esses que
In
hoje
order to give the answer to COVID, these are the processes that we have. So regarding challenges, we have restrictions of the activities in health facilities and communities on account of the pandemic.
Elas foram
These very
percebidas
restrictions
que
were
foi
anticipated by the law from the government in order
e
to
outro desafio nós
guarantee
encontramos
security of the Mozambican population. The other challenge,
da situação de Covid-19, esse desafio
the other challenge
culturais que é teatro e dança tradicional.
is
As
has
atividades
to do with the carrying out of these traditional activities.
presencial
The
aqui
same
no
activities, because of the pandemic and the restrictions given by the government, it added more to challenges because they could not do the choreography and other activities like theater, because this involves a lot of youth.
grande desafio
So because of the pandemic, we could not
e esse
have
desafio
a huge number of youth. So this challenge contributed and it's still contributing in the reduction of the numbers that we seek to cover in the organization.
meu muito obrigado.
So with these words, would like to thank you. I thank you in our local language and thank you for the attention. Thank
Aprendimos o
you
importante.
one more time.
Também algo de cena hoje. Muito obrigada.
Thank you for the work that you did.
O prazer de apresentar
Now
que nos contará sobre aquele papo.
we are going to hear from
Que viveu em Maputo e em Portugal
our
durante
colleague who
anos
lived
para
in
sua
Maputo
licenciatura em Ciências da Comunicação.
for 4 years. He studied for the Science of Communication and Public Relations
Trabalhou na FMCG
and worked also MCGA
como
and
assistente de
started
marketing.
to work in
Ali agora eu
PCA as
para
an
PCI
marketing
para
assistant.
SMC e também para os projetos adolescentes de aquele
Also
papo.
for the branding
outros
of
projetos
PCA as well as the
é
other
muito
project
palavra
of ABC. You have the floor.
Boa tarde a todos. Meu nome é Alia Jusub. Estou
Good
aqui
afternoon. My name is Ale.
visão aquele papo.
I'm here to talk about
Moçambique,
the PAPO representing Mozambique.
projeto.
PAP, one of the main objectives of this project is to add the demand in the population from 14 to 15 years. We understood that the youth are not engaged with our messages, which are main. They said that they could not understand why they do a family planning. And what we did was to carry out a study where we placed the youth in the center of everything and how to involve the adolescents in health and well-being. We wanted to know what they understand, what is it that influences them day by day. And with this, we learned that boys and girls, they don't have only one source of information which is credible. They seek the information from Google. They don't know how to infiltrate. We also learned that the models in their life, it's from the soapies, they watch soapies. So we understand that this is what engages the boys and girls, and it's easy then to engage them in conversations. We also understand that PAPO is for the adolescents. because we talk about issues of day-to-day and family level. We are on platforms online with the objective to giving them more knowledge. In different episodes also we find them for their well-being and future. So with this production for the adolescents, we are able in town to create relations with them through messages that attract to them. So this campaign it's about 360 degrees for the youth, and it has a main scope that disseminates these messages through different channels: Instagram, WhatsApp, Google, social media in general. And we also support them. Where we exhibit these episodes, we work with those who are school officials and creating partnership. In community events, we interact one-on-one between girls and boys, where we talk about the main messages that we seek to transmit. We also talk about the period which was exhibited in 2019 with 19 episodes of 21 minutes each, talking about the sexual aspect and also frankness in this chat with adults and adolescents. They sought more, and we were able to go to the next phase. In the second phase, we asked, the adolescents asked us to make more episodes with 23 minutes each episode. And also the youth sought to find teachings regarding unplanned pregnancy and also HIV. With the second one, and through the strategies and partnership of other brands. Just to point out that for the adolescents, these are the scriptures that we provided. Everything is done and tested with adolescents. The results have been encouraging, and it met our expectations regarding the audience in TV. We have 9 out of 10 TV stations. We had in each episode 283,000 people watching through Facebook, and also 80,000 followers with over 300,000 comments. We were able to make over 300 23,000 continue to use this method. 68% of the people, they still remember the message regarding HIV. At least they know one of the methods of family planning, and using the celebrities there and some characters in the soap, they are able then to get the message across, and consequently they take informed decisions. We will have also another one which is new, talking about methods of contraception and also the relationships with older men, the drug usage, and also entrepreneurship. And then we are going to use new soap characters from Maputo. We are going to Nampula. That's where we are going to exhibit this. From me, thank you. That's all I had. Thank you.
Muito obrigada, súper interesante, estou motivada também
Thank you.
a ver a
It's quite
telenovela.
interesting.
Infelizmente, a Alia não pode
I would
estar
love to
conosco
watch
para
that
as
soap,
perguntas,
says Monica.
mas
You
temos
can
de dar as
also
as suas
expect
colegas
some
Cia
questions and
Moza, que
answers.
poderá responder as perguntas sobre
We
aquele
also
papo.
would like to
Cia nasceu e vive há
give
27
Musa
anos em Maputo,
a chance
Moçambique.
to
É
answer.
graduada após 4 anos de estudo em ciência da comunicação pela
Is
Universidade Politécnica,
graduated with
com foco
4 years
em
of studies
até
in
agora, Cia tinha dedicado seu
Polytechnical
trabalho a entender o que
University
faz
in
as pessoas se
marketing
mobilizarem,
and
como podemos nos mobilizar como um
advertisement.
coletivo. Nos últimos 8 anos, Cia tem sido locutora de rádio e assistente de pesquisa na sua universidade. Trabalhou como jornalista de entretenimento local, co-desenhou eventos e simpósios, co-desenvolveu e gerenciou campanhas e atividades de marketing em todo o país para uma ONG e atuou como gestora de contas de uma agência líder de comunicação e publicidade no país. Desde 2020, trabalha na PCI em Moçambique, onde é
She
oficial de
works
comunicações,
in PCA in
desenvolvendo
Mozambique.
conteúdo para
She's
saúde
an
sexual
official of
reprodutiva,
communication.
água e saneamento dos
She
programas da SPC.
is in the
Vamos
area
tentar, então,
of
responder o
health,
maior número de perguntas
sexual
possível
health and
no chat de
reproduction.
perguntas e respostas.
We
Muito
will
obrigada,
pose
Chacia,
some questions
pelas
where we're going to seek some
contribuições.
answers from that.
Fazer breve
Thank
trailer
you for the
antes de
interesting
Esperança marcar
contributions. So we are going to talk about that. I saw Moses contributing, but his microphone is off.
Ok, então a tecnologia às vezes atrapalha, mas estamos então na sessão de perguntas e respostas. Estou a enviar uma solicitação para ativar também o microfone dos
station.
participantes. E temos
I was
uma
also
pergunta
told to activate the microphone.
para
We have a
fazer
question
perguntas no chat.
and also to motivate
É para Moisés.
for the
Moisés,
question. The
como
question
é
is
que
for
conseguiram
Moses.
passar de 6
How
membros
did you
participantes, 350
manage
na organização,
reach
aumenta o número de participantes dessa maneira tão importante?
154 of the participants?
Muito obrigado. Realmente é uma
Thank
história.
you.
Mais uma vez, dizia eu muito obrigado.
I was saying thank you for the question that was posed.
Foi uma iniciativa de 6 jovens.
It
Uma vez
was
que a
an initiative of 6 youth members, given that Nangida is a name of association composed by youth. On account of their activities, they were able to bring more youth. They like the initiative. On the other hand, these very activities of the organizations, they are directed to the youth because it's our main target, our aim seeks to find youth that are up to 24 years. So they were very accommodated, and it should be better to bring in youth of their nature, because like that they will be open regarding sexual health and reproductive, and to bring also the other youth just so they will communicate with the other youth, and they had the interest. That's why we've been increasing today to 254 youth members.
Obrigada, Moisés. Exemplo para outras
Thank you very much. That's an example for other organizations. Just one question regarding PAP. How did you select these youth just so they will be actors? What was the creative process for the content? Thank you very much. Good afternoon.
Bom, para a seleção dos atores do aquele papo,
for the
nós trabalhamos
selection
com uma
of
agência
the
moçambicana.
members of PAP, we work with the
Da primeira
Mozambican
e segunda
agents.
temporada já variou da agência,
From the
mas nós
first to the
conseguimos carregar os
second
mesmos atores e foi feita
period,
uma
we were
seleção
able to
normal de
bring
casting para que
about
os jovens fossem lá, apresentassem, se mostrassem o seu talento e
some
os melhores foram
guests,
selecionados.
and the youth were able to
O mesmo
exhibit their
ocorreu
talent there.
de Nampula.
The same happened
O processo
now in the
criativo,
case of
como a minha
Nampula, for
colega
example.
dito,
The creative
muito por
process
nós
that we had,
primeiro conversarmos com os
it,
jovens e definirmos temas que eles queriam ver, assistir, portanto,
we
depois
they defined what they wanted to see.
Foram
And
partilhados com uma equipe técnica,
scripts were
envolveu
elaborated
parceiros,
and shared with the
NCS, por
technical
exemplo,
team,
e
involving
outros
other
órgãos
partners like
importantes em
SNS
Moçambique,
and
tem a ver
other
com o Ministério da
entities that are important in
e que
Mozambique.
pudessem dar suporte aos
Ministry
outros
of
temas
Health
também do
is one of
Ministério,
them, that they would
para que eles
help
pudessem, de
regarding
facto,
other themes of
certificar que aquilo que
this
nós estivéssemos a
series,
divulgar tivesse
and they were also able to
depois disso, fizeram-se os testes
disseminate what we were divulging, technically speaking. So they guided the youth in the communities for the sessions of this focus group, just to know whether this would work in the context of their creation. So we carried out with the episodes being exhibited as showbiz. Thank you for the contributions. Just to keep up with time, let's hear about Papu and what they bring for us. Thank you.
Então, meninos, prontos para mais um trimestre?
Eu não aceito ser uma das.
Ei, calma. As coisas não são assim.
Isto é sério. Vá direto ao assunto.
E deu belo.
Não perdi nada. Pois não?
O meu período está atrasado.
Edson! Beleza não é tudo. A tua superficialidade já me cansa.
Este final de ano promete.
Qual é o teu nome?
Agora, tenho o prazer de apresentar a Esperança Macamo. Esperança é ponto focal do SAR.
Now I have a pleasure to present Macamo from Tete province. The presentation will be to do with marginalized community in the area of HIV. Esperança, you have the floor.
Boa tarde a todos.
Boa tarde.
Good afternoon to everyone. Thank you for the invite. The microphone is
saúde escolar,
off. I don't know whether you can hear. Oh, sorry, is the different person.
População marginalizada e vulnerável.
The marginalized population and vulnerable in Mozambique.
Rapazes, raparigas, vulneráveis.
Working with adolescents, involving girls and boys who are vulnerable in Tete.
Os adolescentes jovens desempenham papel importante.
Just to point out that they are mine workers. So the youth are quite important in their role when we are to set up policies. The youth are faced with huge challenges just so they will have healthy lives. They are limited to education. They have no much access to health.
Sexual reproductivo.
Or I meant to health care. They are limited. Also to information. And these norms increase the kind of vulnerability and leading them to have early marriages, the infections on account of sexual transmitted disease. The girls from 14 to 15, they are 3 times more vulnerable than boys. The HIV and AIDS is the main causes of death from 15 to 24 years, and it affects more girls. The knowledge regarding HIV and AIDS is more disseminated in urban areas, so it's quite worrying. The usage of contraceptives is less from 15 to 24 years old youth. So this was found through the research made by the health officials in 30 provinces, to name but one. SASH, rehabilitated by QAM, in 2018 to 2020. In this context, we encountered many challenges in the state. There is less adherence of youth. Health care of the youth with special needs. I have the challenge of increasing the nurses that is in the districts, also in schools. For the growth of relationships in QAM, we have sought the Department of Health in order to have in the schools centers of counseling in the 3rd province. The strengthening of capacity to nurses of such, the divulgation of information regarding the sexual health and reproduction, and also the SITDs, and that should be done in communities. QAM is helping DPS through the intervention of health in the reproduction, and also to help the youth who are marginalized and with special needs. This graphic here demonstrates the numbers. For example, in 30 province, we have the SAAJ in these provinces. 16 specific, 101 not specified. We also have a canteen. On the side, we have these health facilities with such representation. In conclusion, given all these challenges identified, we still need the help and support of the partners in order to strengthen the health system in the counseling that should be done in schools. Also, the increasing of human resources, continue to disseminate the information in communities is that aspect. So DTS is to thank this work that QAM does, aiming then for the health of the youth and to grow even more. Thank you for the attention that I was given.
Muito obrigada, Esperança. Importantíssima experiência. E agora vamos então.
Thank you, Esperança. It's quite good experience.
Eu vou ler
Do you have any question that you received from Serge? I will read the first question.
que são
For the youth
organizações
in Beira,
que manifestam interesse em discutir sexualidade,
whereby there is an interest of sexual guidance, the person who wants to pose this question
discussão aberta sobre esses temas
wants
pode
to know
trazer
what are
para
the
os adolescentes e
changes
jovens
in this theme, just so they will help the youth. Thank you.
Este interesse, os jovens,
There is this interest manifested, and progressively so among the youth. They have come to the youth in order to join the other youth members. Then it will allow for dialogue between or among youth, and in this way they will be helped in communities, because the youth grow up knowing sexuality and what are the rights that have to do with
maior número de
health.
jovens conhecendo quais são
So many of
doenças
the
de
youth
transmissão sexual, quais
who
são
know
de comunicação para garantir a prevenção
sicknesses or illness sexually transmitted, just so they will prevent also the unwanted pregnancies. We are carrying out then what we call follow-ups, and we make meetings for dialogue. And through this, there was a reduction, a significant reduction. So we also do this through radios with the youth in order to debate themes around health. At some point, the youth, they pose some questions of curiosity. Also, they have challenges interpreting key messages of sexuality. So, in order for them to set their messages across, they need information around health. So we have today the reduction. We have the reduction. We see reduction in unwanted pregnancies, because the more the youth know about the sexual health and reproduction, that reduces also the number of infections sexually transmitted, because we engage them in a frank manner.
Agora, para os
Thank you
colegas
very
da
much.
ICAP,
For
Ana,
now,
segundo você,
Anna,
tem havido alguma mudança na percepção dos
have
amigos,
you
da
seen
família,
changes?
da sociedade em geral,
Have
que
you
você
seen changes
identifica
in the society in
atualmente? E depois,
general?
Fernando, se acha que o
Thereafter,
acesso
Fernando,
tratamento em Moçambique é fácil, se está garantido.
what is the access then to healthcare in Mozambique?
Mais uma vez, boa tarde. Mudança no verdadeiro sentido até
Once again, good afternoon. A change in 2021 that we are is not complete. So we still have a lot to be done. So the change that I mentioned here, it was in 2007 until 1999. Because in that time frame, I could understand that we had more teenagers willing to work in this area. So they were willing to subject themselves and to be as an example for other teenagers. Not because the work is done, but a lot of youth, they have accepted it. We still have a lot to do in a way to target more teenagers, youth, and put them in the health centers. Thank you. Thank you very much. We got a lot of questions. I think this is one. In experience in QAMP and health in Beira, I would like to share the experience of the teenager that they live with HIV, and their characteristics.
Sim, mais uma vez.
Okay, once again, in terms of experience of working with QAM for reproductive sexual health, we've got a lot of experience that we have. We have all the following of the age that are linked to the reproductive sexual health. So in terms of retention, what we need, it helps us a lot, the retention of these teenagers. We sensitize them in the community so that we can add them to the treatment. Not only, we also have activity in youth clubs where we put and we allow the youth to know each other so that they can guarantee this. So in simultaneously with this energy at the health centers, what we need that allow the youth that they can meet debates, they can have insufficient information through different platforms that are existing within the search. Unfortunately, we got a lot of questions, but unfortunately, we have to stop here because we can continue with other programs. So thank you very much.
Então, eu vou agradecer ao nome dos organizadores mais uma vez e no meu próprio.
Once again, thank you very much. I've learned a lot, not only from the panelists, but for their contribution and participation in this section, especially this period of the year, to help the Health Foundation team of IIS so that they can be part of this section and that will be part of these questions. So I'll give the platform back to Professor Kenneth after so that he can make the final considerations. Thank you very much.
Thank you, Dr. Negrete, for moderating this session. And thank you once again to all the speakers for their interesting presentations. We would also like to thank all the participants, and we hope that this session has been helpful and interesting to you all. We hope that this information shared and discussed during this session will help you reflect on a personal and professional level and help understand the importance of engaging adolescents and youth as primary actors in the HIV response in Mozambique. We would also like to thank all the participants who sent questions during the discussions, and we also encourage you to share the recordings with your colleagues who are not able to participate with us live today. This will be available as soon as the IIS Educational Fund virtual platform, free of charge, and they can join the platform at any time and watch the replays, which will be available next week. Thank you all and take care of yourself. We hope to see you tomorrow for our third and fourth sessions and the final day of the symposium. The third session will focus on the way forward preventing mother-to-child transmission and stigma against women, and the fourth session will focus on HIV activism and resilience, lessons learned from disasters and outbreaks. Please connect with the link in the platform for sessions 3 and 4 as you have connected for this session. We will see you tomorrow. Thank you.